been part of Atticus, I've noticed there's been it's quite different to a lot of organisations. They have a very innovative integrated home care model, integrating their own large network of home care providers, home care clients, as well as various GPs who are very active in the residential aged care setting. So for a geriatrician working in Atticus, I think it means there's a very large number of settings that you can work between, whether that's through residential care facilities or people receiving home care in the community, or even just in the general sort of clinic referral setting, which is the bulk of private geriatric work. That sort of integrated care, it does work. I've seen it work, and I've seen it do things that you probably wouldn't be able to fulfill at other organisations. I used to work solely in the public system, and it would be very, very difficult to take some time off if you needed to, whether it's going on holiday with family or whether it's going to a conference or going to a workshop to learn some new skills. You have to be organised months and months in advance and get approval from multiple people. Here, sort of working with the Atticus group, they've been very, very flexible and accommodating. If I've needed to go to a workshop or a conference or do even just some personal projects or family commitments on the side, I'm very straightforward and easy just to put in a bit of prior notice and just even block out some days on the grid and kind of move my schedule around to suit my career and educational and personal goals. One of the things I enjoy the most about working at Atticus is that they have a bunch of really knowledgeable and caring general practitioners to work with. That means that I'm constantly learning things from them, as well as witnessing the really good things that they're doing for their patients. So almost every week there's always a couple of occasions where I think, wow, that's really made a difference in their life. It's having those really good GPs to work with that's been one of the really positive things working at Atticus.
One of the things I've really enjoyed working with Atticus has been the continuity of care, particularly going to the same nursing homes over a period of time. I've developed a good rapport with the facility, and similarly with myself and with the team here at Atticus, which I think has been a very useful and integral part of this model. Working with Atticus has been great because if I had any ideas, it's certainly been receptive to those ideas, and I've been given the autonomy to practice in the way that I feel is appropriate for my own development as a clinician, but also in my patients' best interests as well. So while we are an inclusive and integrative model, we certainly aren't restricted by those boundaries, and we have the ability to be creative and practical in how we address our clients' needs. Certainly moving into aged care facilities and as a new clinician to a new organisation, I was a bit concerned about the number of referrals I would have and how busy I would be. It didn't take very long to realise that there was a very strong established network of referrals, which allowed me to fill my books essentially to my liking as soon as possible. The administrative staff, as well as the number of referrals, allowed me to be flexible with my time, particularly with my young family and being able to do school drop-offs and the rest of it, that I was able to pick and choose the times that worked for me into my lifestyle, and that flexibility has been fantastic. I've been really happy working with Atticus and very supported by the team, both from clinicians as well as the administrative staff, and continue to look forward to working with them.